Good afternoon. My name is Devin Shaw. Thanks for tuning into my research presentation. So the question I'm asking is, how do universal helmet laws in the United States affect motorcycle crash fatality rates? And do they have an impact on the societal economic cost savings generated by helmet usage? Why does this matter? Well, helmet laws vary significantly state by state. Since 1967, the federal government has incentivized states to pass helmet laws, but still only 20 states have universal helmet laws, and a number have even repealed those laws in the last few decades. There are a lot of opposing viewpoints on this matter. Personally, I think the safety gains of wearing a helmet are obvious, and I'm okay with their use being mandated, just as with seatbelts. However, I could see it hard to decide legislatively where to draw that line. I personally ride a motorcycle every day and wear an airbag vest in addition to a full face helmet, but I'm not sure whether I would support legislation requiring everyone who rides to purchase an expensive airbag. Many see riding without anything covering their heads as an embodiment of the freedom of being an American. On the economic side, it would seem like there should be some benefit to having fewer major head injuries and deaths, and some states even tie their helmet laws to a requirement that those who do not wear helmets have a certain amount of health insurance. I've also heard the viewpoint of that motorcycling is so dangerous that a crash is likely to be catastrophic with or without a helmet, and they would rather be dead than have their spine broken or another life-altering injury. I even came across an article in a 2011 issue of the Journal of Law and Economics making the case that a downside of helmet laws is that they lead to a significant decrease in available donor organs. The article quoted a transplant surgeon who said motorcycle fatalities were his #1 source of organs, and also provide the highest quality regular source of organs because the donors are usually young, healthy people with no traumatic injuries to the body except the head. Well, let's get to concepts and variables. Our independent variable in this case are universal helmet laws in individual states. Our dependent variables are firstly motorcycle crash fatalities. The expected correlation here is that states with universal helmet laws will have lower fatality rates. Our second dependent variable is the societal economic cost. The expected correlation here is that states without universal helmet laws will have higher economic costs related to helmet usage. Let's define these variables. Universal helmet laws are laws requiring all motorcycle riders and passengers to wear a helmet on public roadways, regardless of age or other circumstance. Currently, 20 US states have universal helmet laws, 27 states have partial helmet laws, and 3 have no helmet laws. For the fatality rates, I used 2017 data gathered by the Fatality Analysis Reporting System and published by the National Highway Traffic Administration. I referenced this against state-by-state data of all 2017 motorcycle registrations published by the Insurance Institute for Highway Safety. For the societal economic cost, I used 2017 data from the NHTSA on the comprehensive cost savings of all helmet usage in the state, including optional use. These costs include lost productivity, medical, legal, emergency service, insurance administration, congestion, property damage, workplace losses, and valuation for lost quality of life. My hypotheses are that states which have passed universal helmet laws will have fewer motorcycle fatalities, and states which have passed universal helmet laws will have a decreased societal economic costs related to helmet wearing. My null hypotheses are that there's no correlation between universal helmet laws and motorcycle fatalities, as well as societal economic costs related to helmet wearing. My research design's methodology used a quantitative model. I used 2 data sets from the NHTSA showing fatality rates and comprehensive economic costs and cross-referenced them against the motorcycle registrations by state. This is a most different systems design. My independent variables are different in that they are states with and without universal helmet laws. My expectation is that will lead to significantly divergent outcomes in both fatality rates and societal economic costs due to helmet usage. The way I'm going to measure this is I will first compare states with and without universal helmet laws percentage of fatalities of total registered motorcycles, and then I will compare states with and without universal helmet laws percentage of economic cost savings per registered motorcycle. Findings. So States with no universal helmet laws had about 63 fatalities per 100,000 registered motorcycles. States with universal helmet laws had about 59 fatalities per 100,000 registered motorcycles. Also, states with no universal helmet laws had an average comprehensive cost savings of $1,633 per registered motorcycle due to helmet usage. States with universal helmet laws had an average comprehensive cost savings of $3,825 per registered motorcycle due to helmet usage. But before we get too excited about these results, let's look at the p-values. The p-values for motorcycle fatalities were 0.9999 and 0.9998. The p-values for comprehensive economic cost savings were both almost zero. What does this mean for our null hypotheses? Well, for the null hypothesis about fatalities, because the p-values are greater than 0.05, I cannot reject this null hypothesis. For the null hypothesis about economic cost, though, because the p-values are less than 0.05, I can reject that null hypothesis. What this seems to show is that states with the universal helmet laws have about 57% more comprehensive economic cost savings from helmet use per registered motorcycle than states without universal helmet laws, supporting one of my initial hypotheses. As for my other hypothesis, a revised research design should be developed to better understand the relationship between universal helmet laws and motorcycle fatalities. I can identify some potential flaws in this research design. For one, the data I used to determine how many motorcyclists there are was the number of registered motorcycles. This is flawed in that one person can have multiple motorcycles or not register the motorcycles they have. It would be even better if I had data that could quantify motorcyclists based on the average number of miles ridden per year, but I was not able to find this data. There are also a number of potential confounding variables. Weather is a big one. Based on the data I used, Maine, a state with no universal helmet law, has a lower fatality rate than California, which does have such a law. However, Maine has maybe only 4 or 5 months of riding weather a year, whereas in most of California, one can ride year-round. From the data I used, it seems clear that there is a generally positive correlation between universal helmet laws and economic costs. I was a little surprised that the difference in fatality rates was not statistically higher. This could be explained by a flaw in my research design, and it would be worth exploring this topic further with more varied data sets to rule out confounding variables. Thank you for taking the time to watch my presentation.